Hi, I did my presentation on spina bifida. So, what is spina bifida? Spina bifida is the neural tube defect due to the spine and spinal cord not forming properly, leaving the spinal cord and spinal nerves exposed. The neural tube typically forms in the early stages of pregnancy. Symptom severity is based on where the opening is, how big the opening is, and whether or not the spinal cord and nerves are involved. Some symptoms include bladder and bowel issues, weakness and loss of sensation in lower extremities, inability to move their legs, and cognitive impairment. There are 3 types of spina bifida in which symptoms vary. Spina bifida oculata, which is spinal nerves are not affected, so there are not many symptoms, but you may see a gap in the newborn skin on that area. Then we have meningocele. This type can affect bladder and bowel control. And myelomeningocele. This is the most severe form of spina bifida. The spinal canal remains open along the vertebrae, so tissue and nerves become exposed. People may experience lack of movement in the legs, lack of bladder and bowel control, and could even have a buildup of fluid in the brain, placing pressure on the brain tissue. So what are the causes of spina bifida? The main cause of the neural tube defect is the lack of folic acid, which is also vitamin B9, during pregnancy. There is a combination of risk factors such as genetic, nutritional, and environmental factors that can cause this condition. So, are there any treatments? Yes, there are 2 main types of treatments that are used for spina bifida. One is fetal surgery during pregnancy or surgery for the baby immediately after they are born. So for the exercise testing, for cardiorespiratory, for ambulatory patients, I would have them do the step-in-place test. This will allow them to have the test be done in a safe manner, because if they do have the function to walk, it may not be the best form. So we want to make sure that we're keeping our patients safe. For wheelchair-bound patients, they would do the 6-minute push test, which would involve them pushing their wheelchair as many times as they can for 6 minutes to see how long and how many they could do in the 6-minute time. For muscle strength, they would do the hand grip strength test. For muscle endurance, I would have them do the arm curl test. For flexibility, I would have them do the chair sit and reach test. And for body composition, they would do the skin fold assessment. So most of the exercise testing I would have clients with spina bifida do involve the arms because they have full motion in their upper extremities. The concern is in the lower extremities. So we want to make sure that the arms, especially for wheelchair patients, are strong so they're able to move the wheelchair. For the exercise prescription, depending on severity of diagnosis, exercise prescription can vary. Patients with spina bifida are heavily encouraged to exercise daily. So for aerobic endurance, I would have them do 50 minutes or more and should be performed at least 3 days a week at a moderate to vigorous intensity, which is about 50 to 85%. Aerobic activity that is recommended in water, so a lot of water aerobics helps with low pressure on the lower extremities, but still getting them their exercise. It is recommended that it is performed in increments of 10 minutes, so they don't get tired easily, but still can continue exercising the way that they should. For resistance training, 60 minutes should be performed for at least 3 days a week at a moderate intensity, which is about 50 to 70%. Exercise should include arm curls, overhead press, bench press, or if in a wheelchair presses. So again, those are mainly arm-based, especially if the lower extremities are not as strong, and we want to make sure that we limit the risk of anything happening to the lower extremities. And for flexibility, flexibility should be performed 3 to 4 days a week, 10 to 30-second holds, and the intensity should be holding the stretch until tightness or discomfort. Ambulatory patients should do dynamic stretches, while patients in wheelchair should do the static stretching. And then here are my resources.